There's quite a few things that excite me about emergency medicine. It's hard to list just one. Emergency medicine requires you to have an understanding of a vast swath of different fields, and I think one of the things you can gain from that is that you can motivate yourself to become an expert in any number of those things. When I came to this program and I saw what they had to offer residents, I couldn't say no. There was just too much opportunity and training, too many resources to help you develop a career, where I felt like this program had it all, and to go elsewhere would have been to my disadvantage.
The breadth and depth of expertise in the Department of Emergency Medicine at Sinai is awe-inspiring. Our department has a dozen emergency medicine critical care faculty, half a dozen toxicologists, 19 pediatric emergency medicine physicians, and national leaders in ultrasound, health policy, emergency medical services, health disparities, and the only funded research training program in emergency medicine.
I think the future of American healthcare is going to depend a lot on having people that are trained to taking care of whatever your problem is right here, right now. And I think emergency medicine is the best poised to take advantage of that new era.
Our residents are an integral part of everything that we do at Sinai. Together we're designing our new emergency department, we're leading the nation in clinical education and research, and we're innovating in the delivery of emergency care.
The goal here is to create clinical leaders that are going to kind of lead and change the field of emergency medicine and of medicine more broadly.
We're so proud to train the next generation of leaders in the field of emergency medicine. Our 4-year curriculum builds in time for mentorship, time for education, time for research, and provides lots of resources to make sure that we plant the seeds to develop exciting and important careers.
The first year, basically, you're just learning the basics of emergency medicine. You spend a lot of time in the emergency room seeing the middle to lower acuity patients, just learning the basics.
In your second and third year, it's all about volume and managing critically ill patients. You're going to see a high volume of critically ill patients and start to feel really comfortable walking into a room and being able to manage whatever you see in front of you.
And your fourth year, we call it a pre-attending role.
Having looked at programs both in the city and all up and down the East Coast, I really was drawn to the diversity of training here.
Our residents split their time among 3 sites: the Mount Sinai Hospital, Elmhurst Hospital Center, and Mount Sinai Beth Israel. The Mount Sinai Hospital is a high-tech quaternary care center where many cutting-edge treatments start. Patients come from all over the world to seek care here.
Elmhurst Hospital is the best hospital in the country for learning medicine. It's a city hospital with a very underserved population, and a really special one. Elmhurst is in Jackson Heights, Queens, which is an immigrant neighborhood with people from all over the world. It's such a satisfying patient population to treat because they are here working to make a better life for themselves and their families.
We get to be working with patients who are uninsured, who have nowhere else to go, and being able to be there for them and support them.
This is the zip code in the world with the most languages spoken, incredibly diverse community, incredibly friendly patients, just an amazing place to train, and the food is an advantage as well. Our third site is Mount Sinai Beth Israel, which is downtown. Also a pretty great food spot, but this is also more bread and butter community medicine.
What really makes Beth Israel special is the shared commitment of our practitioners to the social mission. Diversity, inclusion, and advocacy aren't just buzzwords here, they're rallying cries. We are innovating the delivery of care for transgender patients, creating conference didactics that promote awareness around issues that plague underserved communities, and conducting surveillance screening for HIV and hepatitis in at-risk populations.
The people here are just absolutely incredible. My grandfather passed from COVID in the middle of the pandemic. There was so much support, and I'm so grateful to all the people who reached out, and we all took care of each other. And I think that's really speaks to the program and the kind of people that are in this program, that we all took care of each other, we all looked out for each other.
You know, now that I'm just a few months from leaving, I feel like I'm going to miss the environment that's been created.
Our residents will find better ways for us to help our patients not only now, but to help us to define the future of emergency medicine.
You're really joining a family here.